say thank you guys for coming, and I'm sorry I didn't bring snacks. All right, I'm gonna talk about dumping syndrome. I picked dumping syndrome because we are through a surgical floor, and we do get a lot of bariatric surgeries, and this is very common in bariatric surgery patients. So, these are my objectives. The participant will understand dumping syndrome for healthcare providers. The participant will describe the importance of the function of the stomach. By the end of the presentation, participants will be able to identify the 5 symptoms of dumping syndrome. By the end of the lesson, participants will be able to list 3 treatment options for dumping syndrome. At the end of the presentation, participants will be able to understand the anatomy of dumping syndrome and why it is important to educate patients. What is dumping syndrome? Undigested food bypasses the stomach and rapidly enters the small intestines. Food enters the duodenum and gets dumped into the small intestines before being properly digested. Commonly seen in gastric bypass procedures. So what is the stomach's role in digestion? The stomach is the organ in the digestive system that contains mucous membrane, connective tissue with blood vessels and nerves, muscle fibers. It is the mixer and the grinder of food. It takes food from the esophagus. Food is kept up to 2 hours while it is being mixed with stomach enzymes that are responsible for the breakdown processes and changes it into a liquid or a paste. The stomach is also, the muscles move the food content around so vigorously that solid parts are crushed and mixed into smooth food pulp. Contents are moved from the stomach to the small intestine. All right, gastric bypass surgery, we all know about that. It's a weight loss surgery that changes the way your small intestines, absorb and digest food. The surgeon connects the jejunum to the top section of the stomach, which is the pouch that holds about 1 ounce of food. Body observes fewer calories. It's performed laparoscopic, which gives shorter hospital stays, quicker recovery, less pain, smaller scars, lower risk of getting hernia infection. Also open surgery as well. Early dumping syndrome.
I gotta get a care plan. I think they're in the break room.
Early dumping syndrome is rapid dumping of undigested concentrated food mass. It triggers the body to move fluid from the bloodstream into the intestines in an attempt to dilute the fluid, resulting in distended intestines. That results in the bloating symptom that you get. It can occur while patient is eating or 10 to 30 minutes afterwards. It occurs after eating foods rich in table sugar or fruit sugar. The symptoms include nausea, vomiting, bloating, cramping, and diarrhea, and fatigue. Anybody want to add any symptoms to that? I know Chris said that he gets dumping syndrome often.
Missing.
Broken heart.
Oh, broken heart, okay. But late dumping syndrome can occur 1 to 3 hours after eating. Only 20% of dumping syndrome cases. You can get rapid increases in sugar absorption, triggers the pancreas to produce more insulin in an attempt to prevent high levels of blood glucose. But it could overreact and produce too much insulin, causing hypoglycemia. Some of those symptoms include weakness, sweating, confusion, tremors. And anybody want to add any symptoms to that as well?
I didn't have it.
So the treatment.
Sorry.
Okay, the treatment of dumping syndrome is eating 5 to 6 smaller meals instead of 3 large meals. Avoid simple sugars and sugary foods like syrups, soft drinks, and juices. Eat proteins, fibers, complex carbs. Do not drink liquids with your meal. You can add thickener to your foods or your drinks. Chew food completely before swallowing it. some medications, and corrective surgery, reconstructive of pyloric sphincter, or feeding tube. And that is it. Do I have any questions or any comments? I know you guys all have been working here longer than me, so y'all may know a little bit more information about Dumpy syndrome than I have researched.
Patients are gonna do whatever they wanna do regardless.
Okay.
Like eat the sugary syrup and stuff, no matter if they know they
One
gonna
thing-
have some
Yes,
effect.
ma'am.
One thing I have noticed, they're pretty
Over at the station.
they're pretty compliant with the 1 ounce of liquids per hour. They seem to be pretty compliant while they're in the hospital anyway.
About 85%.
Some of them.
About 85%.
Some of them just wanna eat.
Any more comments, any questions? No? Thank you guys so much for taking out time on
Oh,
a very,
absolutely.
very busy day. Missy, don't forget to fill out the evaluation, please.
Person evaluation.